This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.
Good morning, it's Heiko here from the Acupuncture and Air show in Hastings. And here I am, not with Ken Morrison anymore because he's been banned from talking with me. It's just me on my own now. But I've got a special guest with me today. It's Debra Betts. She's an acupuncturist from Wellington. Good morning, Debra. How are you?
Good morning, Heiko, and thank you for this opportunity to talk about my work.
Yeah, and I suppose I couldn't have timed it better because we just finished our conference on the weekend and you won the great award, the William Wong Do Award for contribution to the profession. So congratulations on that.
Thank you. That was, fairly stunning. I was at a loss for words, really.
Yeah.
A lovely award.
But today, this show, we're going to have a particular focus on acupuncture and pregnancy. And we know that you have been involved with women's healthcare for some time now. And so we just want to sort of find out a little bit about you first, and maybe how did you get involved with acupuncture, and then how did you again get more interested in focusing on women's health?
Okay, so I was in a long, long time ago in a previous life, my early life, a nurse, and I went to a talk that was given by one of our members, one of the acupuncturists that's still practicing today. It was a talk to midwives and doctors out at Kenepuru Hospital where I was working at the time, and I was just really interested. I thought it was a fascinating idea that you could, use something like acupuncture to help what seemed to be a lot of the problems that Western medicine wasn't so great at dealing with, a lot of the chronic, pain problems, etc. And I remember talking very excitedly to this practitioner, but there were no courses in Wellington, in New Zealand at the time. And it wasn't until I was a couple of years later, I was in London doing, overseas travel and nursing and, having holidays in Europe. And I came across some courses and just straight away enrolled. So, I was inspired by some acupuncturists here in New Zealand giving some talks. And then after my training, my final year, I actually got pregnant, and that shifted my focus, obviously, to women's health and pregnancy. And when I came back to New Zealand, I just found there was all of this demand for pregnant women who were suffering. They had back pain, they had a lot of the nausea, the problems that people had said, it's just all part of pregnancy. And to me, it was like, well, no, let's see what we can do. And that built up into work with midwives and just really reinforced how useful it could be.
And what about the teaching at the college? And when did that start? And then in the end, that ended up involving you getting a PhD in the end.
Yes, well, I know, it was very surprising, especially for those who know me who would say that, I wouldn't say I was a naturally gifted writer or statistician. Really, it was about having an interest in the area and having some very helpful people who, really supported me through this. So by the time I come back to New Zealand, several years later, a college started, and that was through, I don't know if I should mention names, but there was, some very wonderful people who started up an education college here in Wellington, and that meant that there was opportunity. They were the founder of the college, Oratunji, at the time, was looking for people to help out with clinical supervision, and I started working with him on that, and then he invited me to teach some theory, and just took it from there.
Just went from there.
Yeah.
Now, you ended up you did your PhD but it was in Sydney, wasn't it?
Yeah, so as part of the work I was doing with the midwives and the courses I was running through the college, again, I was running courses very short courses for midwives who were interested in learning some acupuncture skills that was really just part of their midwifery scope of practice. So they made a midwifery diagnosis and then were able to use a few points. So they were very short courses. And as part of that, and their feedback really led to the writing of the textbook because they were just getting such amazing results, and I wanted to share that. And then because of that, I got invited to lecture at different places because it was something quite unique. that was happening here in New Zealand. And because I was being invited to conferences, I met all the acupuncture researchers. And so it was really sort of a snowball effect of getting to know these people and using research in my practice because, of course, the very first question people ask is, is acupuncture safe in pregnancy? So I had to kind of, be able to answer that, and that involved conversations about research and what the research should say. And that led to, after some conversations, a very well-known researcher through UWS in Sydney in Women's Health, suggesting that if she would be my supervisor if I wanted to do a PhD, and which was again very stunning. But we went through the process, and I was accepted for a scholarship, which again is very, was fantastic, and spent the next 4 years of my life really in a totally different role as a PhD student.
Yeah, and now, of course, Wellington now is very fortunate now that you've actually now set up on the premises at the Newtown Acupuncture Clinic, which is sort of right opposite the hospital there in Wellington, and you've set up a specialty sort of pregnancy community clinic. Now, can you tell us a bit about that? Is it certain days, certain hours, or certain conditions? Do you want to just give us a bit of background on that?
It goes back to that idea that what I see in I just go back a bit, what I see with my work with the midwives being able to do, just small amounts of acupuncture, and we also, 10 years ago, we've got a clinic at the Hutt Hospital, an outpatient clinic, is that you can just see the tremendous benefit that women receive from being able to have acupuncture in their pregnancy. So moving into Wellington is the idea of trying to create a low-cost, easy-access clinic for women. And there's a wonderful clinic opposite the hospital that's set up with like 6 open beds with curtains around it, and there are some private rooms, but the idea is a more community-style practice. So we've started a clinic there Tuesdays and Thursday mornings, 8 till 11, and it's a no-book system. People just turn up. There's usually myself, but there's also 3 of us that take turns at running the clinic and working together. And we just provide acupuncture care there for pregnancy at, a much reduced rate than you would pay through a private practitioner. And really it's just to see if it's for those people who might find it difficult to access private care, or just really so that you can increase the frequency of treatment, because that does seem to be an issue about getting the most effect. To
get results, yeah. I know that some of these treatments, say for morning sickness or breech baby, they have actually been researched, according to sort of, modern protocols. But I just wonder just how many patients actually even worry about or care that, the acupuncture has been proven by a double-blind placebo trial, because what I'm finding is most of my patients are just coming from word of mouth. Are you finding that down there as well? A couple of things. Often they are referred by midwives, so I think the midwifery base needs to know that acupuncture is safe, and I think we definitely have the research for that. We have highest level evidence where you've put thousands of women through randomised controls, and you have women in control groups, and there's no difference in outcomes. So in terms of adverse events, so we do have research to look at, and there's been some specialised safety reviews. The evidence, as you I think you're discussing, the evidence around putting people through randomised controls means there's certain constraints on that, which means that you don't always get the same type of care delivered that you would in a clinic, in an acupuncture clinic. And so the evidence is a little bit mixed around how, about the outcomes from treatment. However, there's a whole lot to be explored around there, and the trials are now moving into more real-life situations. Yeah, so personally individualised, tailored treatments.
But some of the older researchers, certainly it's not something we actually even do in clinic. So it's not very relevant to some acupuncturists about some of the protocols I've used, because we wouldn't use this in clinic. They're ideas set by, medical acupuncturists who just want to test out 2 or 3 points and see if that works. And that's not really the way that acupuncturists work in real life.
Now, what
however,
about
I would say it depends on your population, because well, I'm at the hospital, and that's a clinic where we don't see many people. They're just happy with the midwife referral. Because we're opposite the hospital in Newtown, here in Wellington, I'm seeing more doctors than I've ever treated in my life. So, because they're coming across, because we're so convenient, and of course there's a whole lot. There's women there who are medical personnel or associated with the hospital, and they're coming in and they've already read the research. They've already looked at the guidelines, and the hospital guidelines that say that acupuncture can be used in pregnancy, and so they say, oh well, I saw in the guidelines this and this, or I've read the Cochrane review about this, and this is the the sort of treatment I want to have. So I think that's an interesting shift.
Yeah. Now, what about the women that are coming? What are the main conditions that they're coming for, or as a whole? Maybe you could just tell us some of the different types of patients and conditions that are coming in.
Yeah, really varied. So what we've done is we have published some of the population. Just what happens from the hospital clinic, and so we've recorded how many women came in and what conditions they were coming in for. There is a lot of back pain, back and pubic pelvis pain in pregnancy that women are often told just to put up with, but we see a lot of that with, and we've done some sort of outcome measures that show that women are highly satisfied with the relief they get from the acupuncture. There is also a large number. The other next largest population would be women coming in to prepare for labour. So there are all sorts of things we can do to stimulate beneficial responses, really. So helping women, one of the things the midwives report on is helping with cervical rightening, and that's also something that's suggested in the literature. Acupuncture, may have a real role in the research literature. So it's really about coming in 36, 37 weeks, and we work with you to prepare, a woman so that she's in the best possible position to go into having a baby. And that could be people who are going to have cesareans as well, because there's medical reasons why they need a cesarean. We can still do a whole lot of preparation work for, a positive experience and best possible recovery. So those would be the two biggest areas. And then
what about morning sickness and maybe breech baby?
Because we have such, unfortunately, we have waiting lists. So at the hospital, so it's hard for women to get in. So the community clinic more so, people with nausea and early pregnancy. It tends to be a bit of a smaller population though, and then you go into things like the nausea and vomiting, headaches, and migraines in pregnancy, women who are having things like vulval varicosities, constipation, or a lot of the insomnia, having trouble with just general sleep is really disturbed. All of those things next come in a big group together as well. So we do see a lot of that. And then there's some more specific things which might relate to specific problems in pregnancy that we also might see. Blood pressure problems. Women often have these really itchy rashes which are really hard to put up with. Those things we can be helpful as well. Okay.
Now, what about after pregnancy? I mean, I know that there's certain conditions, perhaps postnatal depression or lack of breast milk. Is the clinic also able to accommodate those patients?
So we're really trying to build that up. It's obviously that's part of having the no booking. People can just turn up on those days because it keeps it flexible and perhaps easier to manage when women have their baby at home in that first 6 weeks, or that first month. Really would like to see more of this. It's an area where we don't see enough women because the focus shifts onto the baby, and obviously things can become quite overwhelming. And with lack of sleep, it's not quite as easy to be planning events during the day. But that is something that we have a lot to offer. So we're seeing more of that in the community clinic, and it's a way of exploring things that how we can make it even more accessible to women, really.
Okay. But then, my producer over there is waving to me that it's getting time almost to finish the show. But just before you go, that you've also been involved with another pregnancy care clinic at the actual hospital, which is run through the Acupuncture College in Wellington. Can you just briefly, quickly tell us about that?
Yes, so I've been referring to that. That's an outpatients at hospital, so it's a free antenatal clinic, and it's run through the New Zealand School of Acupuncture, who provide some supervisors there, and the students treat the pregnant woman. So we've been doing that for 10 years.
All right,
So
and is that at a certain day, a certain time?
Oh, that's on Monday afternoons and on Fridays.
Okay, great. All right, that's just good for us listeners to
So,
know.
yeah, so that's kind of a huge amount of things that we could offer in pregnancy for acupuncture. So those of you, or if you know anyone who's pregnant and is just putting up with something that's making their life quite difficult, it's a really good option to explore.
Yeah, well, this show, it's going to get up onto the YouTube, so I'll put the address and the contact details down of the clinic down in the comment section. And so that if so people can go to that. But we better finish the show. And thanks very much for coming on, Debra. And again, congratulations about winning the William Wong-Do Award.
Oh, thank you.
And just to finish the show, I've chosen a Wellington band, a song called Fat Freddy's Drop. And their song is called Ernie. And I'm sure that Ken Morrison here, the producer, it must be one of his favourite songs. And okay, well, here it is.
This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.